CRPS is not a pain condition. Always remember that it is a neurological condition. And until you treat it like a neurological condition, you're just not going to get better. You're going to always just manage the pain. I often put myself in the shoes of a CRPS patient. It affects so many things in your life. It is excruciating pain. So yes, certainly pain is one of the top ways in which it affects patients, and it affects your quality of life. But most doctors don't understand that there are so many other symptoms that get bundled together with CRPS, or should be bundled together as one big condition, not separate conditions. So for example, I would say 80% of our patients also have GI dysfunction. So, that could look like nausea, cannot digest food, cannot use the bathroom, cannot eat anymore, needing a feeding tube, your digestion slows down. Lots of CRPS patients also have a condition called POTS, Postural Orthostatic Tachycardia syndrome, where if you stand up, suddenly you get super dizzy. You could just pass out at the drop of a hat. You may feel lightheaded all the time. Or mast cell activation syndrome, which is basically a condition where you become allergic to everything. I've even seen patients become allergic to things like water, which is obviously a big problem. In medicine, they like to piecemeal these symptoms out. So it's kind of like taking your car to a mechanic, and then the mechanic says, well, I don't know if it's your water pump or your air filter. Let's go in and see if it's your alternator. So they go in and they treat it like parts. But your body is not a car. It's not designed as all these parts, where one thing doesn't affect the other. Everything works together. You're a whole human being, and all these parts connect. So if the central nervous system, that is your master control system, breaks down, it's going to cause other symptoms. Where people go wrong is that they symptom chase. They want the pain to go away, so they take painkillers. They don't want to have GI dysfunction, so they get medications for that. Maybe they get feeding tubes. They get treatments for MCAS. But you're still treating the symptoms, not the cause. So you now may have a question, which is, what's wrong with my nervous system? If that's what's causing everything, why? Why is my nervous system broken and not someone else's? So many people live normal lives and have injuries and they recover, but I didn't.